What is the most dangerous combination of addictive drugs out there? Well, probably combining any of them is kind of dangerous because you get effects from one and the other. But first I'll tell you a story about John Belushi, who died of a heroin overdose, and his combination was cocaine and heroin. The story goes that he'd never used heroin before, but he'd been a big cocaine person. And so some lady came over and injected him with cocaine and heroin combined, and he seemed fine, and she left about an hour later, and then when they went looking for him about 3 or 4 hours after that, he was dead. And what it was that the cocaine had kind of masked the fact that heroin slows your breathing down, because cocaine is a stimulant. So what had happened was he'd taken a whole an overdose level of heroin because he wasn't tolerant to it, he had never used it before, but the cocaine kept him alive because it kept his breathing going faster and stuff because it's a stimulant. But when that wore off, because that wears off after an hour or so, but the heroin lasts for 4 to 6 hours, so then he still had that fatal dose in him, and of course he stopped breathing and dying. So that's how people die from opioids, is stopping breathing. And of course that brings us to the most dangerous combination, is heroin or any opioid combined with any sedative, because sedatives like alcohol or Valium, Xanax, Ativan, Klonopin, barbiturates, any of the sedatives slow your breathing down through one mechanism in the brain. The opioids slow it down through a second mechanism of the brain. So when you're using both together, it's synergistic, is the term we use, where 1 and 1 is more than 2. And it's just very, very dangerous. We see mortality autopsy reports all the time where people have not actually used a fatal dose of the opioids, the heroin or the fentanyl, but when it's combined with their benzos, it's just too much for the system and they don't make it. So anybody using drugs out there, don't use that combination.